Let's dig deeper into all of this and bring in Dr. Nahid Bhadlia. She's an infectious disease doctor and medical director of the Special Pathogens Unit at Boston Medical Center. Okay, we're getting the CDC guidance, and yes, we don't officially know what it is, but it's safe to say they are going to relax mask wearing in some way. How do you feel about that from a science perspective?
Well, Stephanie, what I do for my day job is I run a medical unit that's specifically designed to take care of patients with highly communicable diseases. And when I train my healthcare workers, I don't just tell them the rules. I actually show them where the risk is. So when they find themselves in a situation that's unpredictable, they know how to keep themselves safe. And CDC's current guidelines, right? I mean, states are the ones that are giving the mandates, but the CDC's current guidelines say that outdoor is safer than indoors. I think it's important for people to understand how much safer outdoors is compared to indoors, because otherwise what you're seeing is these blanket outdoor mask mandates by states like Michigan or, in Massachusetts, whereas their indoor capacity is opening up. In Michigan, for example, you can have 100 people indoors, up to 100 people indoors in a dining establishment, which really carries, as we know, 18 times higher risk. So what I'm hoping to see, what the CDC might do, is to have people recognize that in majority of the outdoor settings, the risk level, if it's by color, most of the activities are green. They start getting orange when you're in crowds and in close contact for a long period of time, because that's when you have that opportunity to exchange air, right? You don't want to swap air with other people in enclosed spaces. And it's rarely, particularly if you can put those crowd the numbers to a lower amount in large venues and require the mask, it becomes much, much safer in the outdoor setting than in the indoor setting. So I'd like to have them see that clarified. But the other thing is for them to continue to show the importance of indoor masking. We really shouldn't be letting our guard down there. And the most interesting thing to me is going to be to see if they differentiate between your individual status as being someone who's vaccinated. Now, it does reduce your risk of transmitting to other people if you've been vaccinated, and your risk of actually catching the infection in the first place. But how do you, when it comes to a venue like the Kentucky Derby, how do you sort of check everybody's vaccination status? And so I think it's more likely they will go by how many people in a particular state have been vaccinated, because that might be the guidance to say potentially it's okay to let down blanket mask mandates and pay more attention to crowds and stationary crowds in particular.
But we're really close, with the exception of kids, to every American having access to the vaccine. Is it justified that a lot of people feel like if they have been double vaccinated, they don't want to wear a mask inside anymore? It's not their fault that other people are choosing not to be vaccinated. It's very different than where we were months ago.
I agree with that. I think the tough part is, there's a difference between, there's a difference between what you can actually accomplish with a public health policy versus a guidance, right? And the trouble here is that people can say that, yes, if I'm vaccinated, I should be able to go in an indoor dine. The trouble is, are restaurants going to check people's vaccination status? I don't see that sort of lining up in the near future, and hence it may be safer until more of us are vaccinated before we let those indoor mandates down in a more definitive way. But yes, if you are vaccinated, I mean, this is a point to everybody. If you're vaccinated, most activities become safer for you, including, as we've heard from the CDC guidance, letting your guard down, letting your mask down around other people who are vaccinated as well.
What do you think the timing is on kids getting vaccinated? For those vaccinated parents out there who are ready to loosen things up a little, they can't because they've got kids.
Well, we know that Pfizer has some good data for those between 12 to 15. And currently, Pfizer has a vaccine that's available for over 16. We think that it's likely that the actual data for kids younger than that, these trials are ongoing, and it kind of depends on when their enrollment ends. And the thought is it might be over the summer. And so in line with maybe next year's school year, hopefully the vaccines will become available for kids who are younger than that. But it all depends on when the trials are completed and what the results are in terms of dosage and safety in kids.
At this point, the vaccines are only technically authorized for emergency use. That is why lawyers basically are preventing many businesses and other entities from forcing people to be vaccinated in order to come back to work. When we're past emergency use, should we expect a lot more vaccination requirements?
Yeah, Stephanie, I think you would. I mean, the trouble with the EUA is that there's language in the emergency use authorization that says that patients can accept or refuse the vaccine currently, and because of biological licensing, approval, the full approval takes into account a lot more data. That's why I think that there's more legal ground to stand on when you've received the full FDA approval for these vaccines. Having said that, I don't think this is going to be, if you see universities that have already started to sort of require that for the incoming students, that shouldn't surprise you. Those rules already exist for other vaccines, right? The measles and mumps and rubella vaccine, the varicella vaccine, the pertussis vaccine. Hospitals require flu vaccines in many states. And so private companies, private institutions have required their workers, their students in the past. I think states have mandated childhood vaccination. States haven't actually taken as much of a stand on adult vaccinations in the past, but it's going to be interesting to see how this plays out, particularly in states where the vaccine uptake has been low.
I want to ask you about something that I know is personal to you, the crisis in India. Our colleague Richard Engel has been reporting on it all week, and I want to share a bit of that footage and warn our audience that some of his reporting is disturbing to watch.
Hospitals are so full and lack so many basic supplies, people are turning wherever they can. This Sikh temple in Delhi has a few precious oxygen tanks. People come from miles just for a few breaths. Abu Sadat, weak and motionless, has been trying to get care for 8 days, but he's been turned away by hospitals.
No more beds. No more beds.
Abu Sadat's brother tries to keep him alive and conscious. He's not a medic, but won't give up. Others die while they wait for care that never comes.
At this point, the United States is sending raw materials for vaccines to India, along with PPE and other supplies. Can you remind the America First voter who's watching why it is in our best interest to do this?
Stephanie, I think I'll start by just saying that the situation is much worse than what the numbers show, because the testing capacity has been overwhelmed. And so if you don't get tested, in many hospitals, they're not taking people who are not COVID positive. And so you could die at home and you're not counted as a death. And so the numbers you're seeing are an underestimate. What you're seeing in India is a wildfire of this virus. And the more this virus transmits, the more likely it is to evolve. There's a new strain that's thought to be more transmissible. Thankfully, as new data now showing that the vaccines may still be effective against it. It's the B1617 variant that's partly sort of contributing to the increases, as are large gatherings and just, letting down the guard in many places. We need to do this because our destiny, Stephanie, is tied to the rest of the world's destiny, because if the virus continues to transmit elsewhere, you'll continue to see new variants develop. And so, we could vaccinate our entire population and we would still have that threat on the horizon. That's one reason. The other is economic. There's a RAND Europe study that shows that if there is vaccine nationalism and vaccine inequity, you could see up to $1 trillion loss in GDP, global GDP. And so that's for all of those reasons, we need to ensure that India gets on the other side of it.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.